Welcome back to The Explainer. So today, we're diving straight into the hard numbers of New Zealand's 2026 budget. Based on a deep dive by Webfit News, this budget is really a tale of two entirely different stories. On one hand, we've got a macro-level narrative of tight fiscal discipline and national security. But on the other, well, we're looking at some very real, quantifiable human costs and strain on local communities.
Okay, let's dive into this. The absolute core tension here is summed up perfectly by Webfit News. It's basically a massive mathematical tug of war. We've got macroeconomic stability, getting the nation's books back in the black, pulling against the microeconomic reality of everyday households. Because the big question is, how does balancing a multi-billion-dollar national ledger actually impact a family that's just trying to pay for this week's groceries and rent?
So, here's our agenda for today. We'll start with the core economic goals, then compare the growth forecasts against expected job losses. After that, we'll look at the burden on low-income families, the shift from university to vocational training, the focus on hospitals over community care, and finally, defense spending versus public capacity. Section 1, Core Economic Goals, Discipline and Surplus. Let's get right to it. Finance Minister Nicola Willis has really anchored this entire budget in the harsh realities of global inflation, making a very strong case for fiscal restraint. And what does that restraint look like in practice? Well, it looks like $2.1 billion. That's the strict operating package, which they deliberately kept under the previously expected $2.4 billion allowance. And they've paired that with $1.7 billion in targeted savings and revenue measures just to really, tighten the belt. Now, if we look at the Treasury's growth forecasts, we're seeing a steady climb. We're talking 1.2% growth by June 2026, revving up to 3.2% by June 2028. But honestly, the crown jewel of the government's narrative is right there at the end, a projected return to surplus in the 2028-2029 fiscal year. That is a full year ahead of previous projections. For the government, this is absolute proof that short-term restraint is going to yield long-term economic strength.
Moving on to Section 2, Growth Forecasts versus Job Losses.
Now, what's really interesting here is how the broad macroeconomic forecasts completely clash with the microeconomic reality of the public sector. Treasury is predicting a super robust 220,000 total jobs added to the wider economy over the next 4 years. But zoom in on the government itself, and the Public Service Association is predicting 9,000 public service jobs will be cut over 3 years just to hit those savings targets we talked about. So, broad employment growth on one side and severe departmental cuts on the other. You might be wondering, what do those 9,000 public service roles actually do? Well, the PSA warns that cutting $2.4 billion from department budgets isn't just trimming back-office bureaucracy. These are the people who process superannuation, help with benefit applications, protect the borders, and literally keep community systems running. The government maintains this as a totally necessary overhaul to drive efficiency and cut waste. But critics, they're arguing it's a fast track to processing delays and failing support systems for people who really rely on the state. All right, Section 3. Low-income family burden. Whenever a government tightens its belt, advocates always watch the data closely to see who actually absorbs the impact. And that brings us to $196 million. That is the exact amount the government is saving by reducing maximum temporary additional support payments. Now, the government's stance is that these payments are meant to be a last resort temporary hardship measure, not a permanent income top-up. But groups like Save the Children are saying the timing here is just brutal. When families are already grappling with skyrocketing costs for food, rent, and power, cutting this safety net puts them in a really tough spot. Let's take housing as an example of this. The budget shifts social housing tenant rent contributions up from 25% to 30% of their income. The official fiscal justification? It's fiscally neutral, and it rebalances support between social tenants and private renters, who are actually getting an increase in their accommodation supplement. But if we look at the human cost, critics, including the Labour Party, are quick to point out that 84,000 households are going to face an average increase of $31 a week. So balancing the books on a national level has a very literal, very direct impact on the wallets of low-income renters. That brings us to Section 4, Vocational over University. This is a massive ideological shift. The government is completely ending the broad fees-free tertiary scheme. Their argument is that the data showed it just didn't improve enrollments or completion rates for low-income students. So instead, they're doubling Trades Academy places to 20,000 for high schoolers and adding 1,000 youth guarantee spots. It's a total pivot from universal university fee subsidies to highly targeted vocational training. Supporters are saying, hey, this perfectly matches what the workforce actually needs right now. Meanwhile, critics are worried it might push young people who are already facing high living costs away from university or just deeper into student debt.
Section 5. Hospitals over community. Let's look at health.
Health is actually the single largest item here. Total health spending next year is a staggering $34 billion. To put that into perspective, that equals about $17,000 per New Zealand household. And within that massive pie, there's a $5.5 billion injection targeted specifically at the front line. We're talking emergency departments, specialist assessments, elective surgeries, and cancer treatments. The government is really pouring billions into physical hospitals and acute care centers.
But as Webfit News highlights in their analysis, there is a major counter-argument here regarding the front door of the medical system. While the government is heavily funding hospitals, critics argue that neglecting primary and community care, things like your local GP or early intervention programs, just means patients are going to fall through the cracks. The logic is, if you don't fund the community level, people simply get sicker until they hit an absolute crisis point. Then they end up at the hospital anyway, which puts the whole system right back under pressure. Section 6. Defense versus public capacity. The government's position is pretty stark here. They believe New Zealand is facing its most adverse strategic environment in 80 years. So they are investing heavily in traditional physical security. We're talking $1.1 billion across corrections, police, and justice. It includes extending the life of Anzac-class frigates and buying new drones. Plus, there's a $156 million uplift for intelligence agencies and $150 million to build up strategic fuel reserves to protect the country against global shocks.
But pushback on this definition of security is strong. Organizations like Peace Movement Aotearoa and Greenpeace argue that physical militarization just isn't true security. They argue that to build a genuinely secure, resilient nation, you actually need climate action, poverty reduction, and robust community housing. Environmental groups even point out that building up fossil fuel reserves just locks the country into the exact same systems that are causing global instability in the first place. It's a really profound clash over what actually makes a society safe.
Finally, Section 7. The final balance, 2 stories. Let's synthesize all of this.
So, the crucial point is, which of these stories actually reflects reality on the ground? A budget is fundamentally a map of a nation's priorities. And the Webfit News analysis leaves us with a few key microeconomic tests. First up, can families actually afford food, rent, and power? Because when hardship payments are cut and social rents rise just to balance those national books, the reality for a lot of folks is just severe financial strain.
Second question, can patients see a doctor before they end up in the hospital? Those billions poured into acute care are absolutely vital, for sure. But if community health is underfunded, are we really fixing the problem, or are we just managing the symptoms of a deeper structural issue? Third, can communities trust that public services will still be there when they actually need them? With 9,000 predicted job cuts in the public sector, the government's drive for efficiency is running headfirst into very real fears about delayed superannuation, weaker borders, and fraying social support systems. And finally, I want to leave you with this thought to ponder. Can New Zealand prepare for global shocks without forgetting the people who are already in crisis right at home? Budget 2026 undeniably takes some very bold, measurable steps toward fiscal discipline, infrastructure, and national defense. But whether that discipline demands too high a human cost from the most vulnerable, well, that's the question that will ultimately define this entire budget. Look at the data, weigh the impacts, and decide for yourself which story rings true. Thanks so much for joining me on this explainer, and as always,
You are watching Webfit News.